Staying safe is requiring us to isolate even more profoundly. For example, most people now have to attend appointments alone, where they might have brought family members or a friend, and they can't even visit people either because of the fear of passing on infection. So how can patients who are going through this more on their own at the minute help themselves cope with fear and isolation and the sheer loneliness of the current situation for them?
Sure. So I think there's two things there. The first is for patients going to appointments on their own, and the second is people being in isolation when at home. So if we think about patients going for appointments on their own, I think there have been huge changes within the hospitals now around bringing support along with you. So, and sometimes, as we know, there can be substantial waits between maybe having bloods done and consultations, or just waiting for your turn with the healthcare professional. So I think maybe bringing, where in the past we would have distracted ourselves through conversation with having somebody with us, now it might be a case of bringing things to engage your mind with you. So it could be bringing a book on your phone, so an audible book with you. Mm-hmm. It could be having an app on your phone where you can maybe tune into some music or listen to some music on your phone. It could be doing Sudoku on your phone or a crossword on your phone. But I think it's key to find some way to engage your mind, to try and keep yourself distracted if you're waiting for long periods of time on your own. Of course, another thing you can do is make sure that you're prepared for your consultation with your doctor. So maybe spend some time jotting down some of the questions that you would like to ask, so that you're ready for the meeting. And then once you've done that, put it to one side and go back to engaging your mind in these different activities. Regarding being at home, I think for all of us, for people who have a cancer diagnosis, and perhaps are going through treatment or have finished treatment, but for everybody as well, one of the most useful things, one of the most protective things we have in managing our resilience is our social connectedness. Mm-hmm. So it's really important that we find a way to be creative in how we keep those links maintained. So for many people, it's using their phones. So it could be just a regular phone call, or perhaps it's for those who are comfortable with it or who are able to manage it, it's FaceTime, Zoom calls on the computer. But keeping connected is crucial. It's really, really important. And to try, as we said earlier on, to try and make sure that connectedness is there nearly every day if possible.